Eyes are on President Cyril Ramaphosa this evening as he is expected to address the nation. eNCA understands Ramaphosa held a consultation with the National Coronavirus Command Council this weekend. This as the country has officially entered the COVID-19 second wave. The South African Medical Association's Angelique Coetzee joins me now for a discussion on what to expect. So in the last few minutes, Dr. Coetzee, we've been pulling at this latest surge in coronavirus cases from multiple angles, from what municipalities and provinces are suggesting should happen in as far as the beaches and public amenities like those are concerned. In the next few minutes, we're going to be hearing from the beer industry and tourism industries, and we just heard from the healthcare workers and their concerns about their members getting infected. What's at stake this evening when the President addresses the nation?
Well, it's a good morning to all the viewers out there, and thank you for asking our opinion. What is at stake? We can only speculate, but from SAMA's side, we would expect the minister to enforce the current measurements that's in place. And it doesn't help you bring new regulations in if you can't even enforce what is there currently. So that's the one problem. The second problem is, or the problem there is, it should be enforced. And I'm not sure whether law enforcement or the relevant departments can do this. And if you bring new regulations in, if they can't even cope with the current ones, how are they going to cope with the new ones? The next thing is all our people in this country of South Africa needs to start to take responsibility for their behavior and for their health. We cannot simply expect the National Department of Health or our president to do it for us. We each have a role to play. And the biggest thing is responsibility. From SAMA's side, we cannot think that there's still some persons in South Africa that's unaware of COVID, that is unaware that you need to wear a mask, that you need to social distancing. I don't know how many times this has been said. So either you're deaf or you're dumb if you don't understand this. And again, even the other thing that SAMA would say, maybe look at the curfew, keep the curfew at 10 o'clock, but then in the morning, bring that curfew down to 6 o'clock, and only people that's essential workers can go earlier than that to be in time for their work and their shifts that they need to work with. The other thing is that we don't hear, and everyone is focusing on the beaches. I do not hear anyone complaining about people getting into a taxi, sitting for more than 20 minutes in a taxi, fully packed, in a long-distance taxi or a bus. And this is a much bigger concern than having a beach open and control the numbers of people that's on the beach, as well as make sure that they do their social distancing while they are lying on the beach themselves. In the water, it might be a bit more difficult, but then again, it's open space. It's not closed space. A taxi is a closed environment. Yeah. A bus is a closed environment. So, and if you are afraid, yeah.
Dr. Coetzee, talk to me about your sense of the healthcare system, the health system in the country. There was much talk about getting it ready, and part of what we were talking about when we were talking about flattening the curve was to ensure that the health system is not overwhelmed. And we've come a long way since then, where we saw those, emergency hospitals, field hospitals, being wound down at a particular point. What's your sense of where we stand now as we enter the second wave of the coronavirus?
Okay, again, two answers here. From the medical fraternity, we have learned quite a few lessons from the previous surge that we had, and we are much better prepared to cope with this than we had been in the first wave. Again, I would also would like to stress that the reason we had lockdown 5 was to prepare the health facilities. It was nothing else. It was not to learn and teach people to drink responsible and to have their social distancing. It was precisely because we needed to get the impact of healthcare facilities while we didn't know what was happening. And so that is much better. There's unfortunately still public sector hospitals that doesn't have enough oxygen, for nasal oxygen. We are also very worried about circulars that's been sent out to some of these public sector hospitals telling them that they are cutting down on new personnel and doctors for 2021. There's simply not enough money to employ those doctors. So I would like to make you aware of the fact that from the end of this week, most of the specialists who normally look after these patients in ICU, whether it's private or public sector, is taking their annual leave. So you are going to be let or leave with skeleton staff. And I presume that would be the same for the nursing staff. And it is a problem, but again, if you go to the beaches and you are doing your social distancing and there is what we call natural ventilation there, you have to understand the average time that you will be infected is anything between 1 and 11 days, with an average of 5 to 7 days to have symptoms. So a lot of those people will in any case travel back in the buses, with transport to their respective
So what would be your suggestion then, Dr. Kutsi, as a parting shot? You've emphasized the issues around ventilation and capacity in as far as public transport is concerned, particularly the taxis and the buses. And as you know, during the festive season, it's usually the period of time where many people who do use public transport have that opportunity to reconnect with family in different parts of the country. What would be your suggestion around that? And while you're talking about that, also re-emphasize the issue around the curfew. You often hear people saying that, people quip that, oh, it seems the virus only travels between 10 in the evening and 4 in the morning. Just those 2 points very quickly.
Okay, first of all, the virus doesn't have any idea of time, nor does the virus have any idea of whether it's hot or cold outside or there. And if you want to travel in a bus or in a taxi, I think the government needs to go back to 50%. 50% people in those close environments, make sure that you can roll down the windows, because we want the windows open. We need that ventilation. And that is extremely important. Also make sure, go and look at the stats. Who is taking people to the beaches on New Year's Day and Christmas? Is it public transport? Are there bus loads taking people there? Stop that. And look at the people coming onto the beaches. Control your numbers. And we come back. Just do what you need to do. There's good restrictions in place. Just enforce them. And people, open up your ears. Listen what we are saying, especially the young people. Listen. Do not go where you're not supposed to go. And wear your masks. It's very, very simple.
Yeah. All right. Thank you for that, Dr. Angelique Kutsi. We'll leave it there for now because we want to take you to this live